All right, I want to take just a second and talk about our Braun syringe pumps. So you're going to have 3 of these on your isolette. They connect to each other from a bottom tracking system that when you mount it, they all connect together and they will be in a stack. So we use a syringe pump for our neonate population because they deliver a more controlled administration of medication, and that's super important in our neonate population. So when you get ready to connect a baby to your syringe pump, you're going to have an IV setup that's in your, or a syringe setup that's in your isolette. In that bundle is going to be rubber banded together, and you're going to have a syringe, which is a 30 cc syringe. You're going to have a drug label. You're going to have a blunt tip needle. You're going to have an alcohol prep, and you're going to have your tubing. The process would be that you would connect your needle, your blunt tip needle, to your syringe, and then you would go and swab the port that you're going to draw from with your alcohol prep. You'll then draw up 30 cc's of fluid and connect your tubing at that point. Once you connect your tubing, you'll leave the little cap on and you'll flush that out in order to make sure that your line is flush. That's something you want to do right off the bat, just so you don't somehow forget that, because you can't really tell if there's fluid in here unless you know and confirm that you flushed it. Operating this pump is extremely simple. It's a very easy pump to run. A lot of syringe pumps, you can really figure them out if you kind of play with them. But the first thing you want to do is power it on by hitting the power button, which is the top right button. Once you hit that power button, it's going to light up and start coming to life, and it's going to start doing a self-test. You'll know this self-test is complete because the driver will start opening. Once that driver starts to open, it's going to allow you to insert your syringe. So the first thing you want to do, the drive is opening, you're going to take and open up your syringe door that gives you access to the area that you're going to put your syringe right here. So you'll take your syringe and you'll prepare it. So the way that you're going to insert it is you're going to pull this to you and rotate it to the 3 o'clock position. I don't know if you can see on the camera, but that is going to open this little green piece. Once you do that, you just simply release it, and you're going to take your syringe and feed it into this area where that green keeper is, and you're going to stand this little ridge straight up and down. Once you do that, you'll rotate it and just drop it, and it's going to position the syringe so the driver can get it. You'll shut your door, and you can see that it already has BD30 US. So basically, it's identifying the syringe that is in there. You'll hit OK, which is the same as enter. Once you do that, the driver is going to come get it, and it's going to secure that syringe in the driver. So when you get ready to program, it's going to ask you to use last therapy, and it says no. You put no, and if it asks you if you want to use the drug library, we normally just put them on a pump rate, and we just select no. Not every time does it ask that, but sometimes it will. To set the rate, you're going to start with the rate. You're on the main menu. You'll hit OK, and then you're going to scroll over to whatever unit you want to put in. So if we want to put in 10 milliliters an hour, we would go over 1 and push up to select 10. If we didn't want to give 10 and we want to give 8, come back over to select 0 and then go over here to select 8. And then if you want to give 0.3, you would select over to the right, and then you would go to 3. At that point, once you're satisfied with your rate, you're going to hit OK, which is the same again as enter, and then you're going to scroll down to volume to be infused. You'll hit OK again, and since we pulled up 30 cc's in that syringe, I'll go to 30, hit OK. At this point, you're ready to start giving your infusion, and you just simply hit start. You'll know it's flowing because you'll have this little series of arrows that is showing that it's flowing toward the patient, which is down this way. Once you get ready and you want to transition and give your baby to the NICU and you want to take the syringe out of the syringe pump, the first thing, and this is very important, is to hit stop. If you can certainly take the syringe out without hitting stop, but it causes you problems when you go to power down this syringe pump. So hit stop. Once you hit stop, you see that it's no longer flowing. You'll open your door and simply open your door, your little keeper up, and the syringe will release. The driver will open, you'll take your syringe out, and you'll set it to the side or transition it over with the baby. You'll close your door, and then you'll rotate this back to the 12 o'clock position and power down your pump. To power it down, you'll hold your power button for 3 seconds, and the driver will close to its parked position. Once it gets to its park position, the power on the pump is going to shut down. And that is a Braun syringe pump, very easy to pump to operate. You may also use this for if you're given a Aerogen type, Velitri, whatever, nebulized treatment on adults or pediatrics. So something that you need to be very familiar with.